Hello, everyone. My name is Chris Foster. I'm faculty at Thomas Jefferson University in the Department of Family and Community Medicine. Welcome to my poster presentation today on the development and integration of pediatric electronic health record SmartSets and an academic family medicine clinic. So, some brief background. Electronic health record usage in clinical practice has accelerated in recent years. Clinical tools such as computerized reminders and the EHR have been useful in guiding provider adherence to known recommendations for pediatric care. And recent data suggests an alarming downtrend in the number of children cared for by family physicians, largely in urban and suburban areas. In 2017, Jefferson Family Medicine Department, as well as the institution at large, transitioned to from our former electronic health record over to Epic. And we found that this might be a unique opportunity to utilize the enhanced functionality of Epic to advance patient care, as well as address potentially some gaps in our residency education. We knew that electronic-based interventions, such as the integration of SmartSets, could really have potential for accelerating the adoption of routine recommendations and guidelines into practice for physicians. This is actually an interesting follow-up to lead screening project that we implemented in our department years ago, where by just even implementing a small change in the template for pediatric patients who are between the ages of 12 months and 6 years old, just to ask whether or not pediatric lead screening had been performed, it resulted in provider behavior changing to really address that gap in the healthcare. And so we thought that this would be a unique opportunity to really take advantage of some of the pediatric functionality and really enhance some of the patient care as well as resident education in this area. So some of our aims, we hope to enhance residency education around pediatric well child care, also improve health screening and counseling for our pediatric patients, and then thirdly, to improve routine vaccination and lead screening rates, as well as some other health outcomes for our patients. The process by which we performed this intervention, first we developed and built a custom set of SmartSets, which if you see this image above is just an example of a SmartSet for our family medicine department for all pediatric ages. We were able to subsequently implement the SmartSets into clinical practice. Provide some education around the use of SmartSets. We did email and an online module, which I'll talk about briefly, and then sought to evaluate some of the clinical outcomes as well as clinician satisfaction with this tool. Assessment of the SmartSets, we did collect some data, which I'll talk about briefly in a moment, but also I'm just looking at how frequently the SmartSets were being utilized by the clinicians for the appropriate patients when they were seen in our clinic. We wanted to look at some outcomes, that is immunization rates, lead screening rates, was developmental screening documented, did we appropriately document pediatric obesity, etc. Some surveys where we can collect clinician satisfaction, and then also some questions about resident self-reported confidence and competency in providing pediatric care to patients. So the format that we were collecting this data, one is data abstraction through the electronic health record, with the use of health information technology and the team here at Jefferson to pull the data from the pediatric encounters that we've seen from August 2018 to present, going all the way through September of 2020. This was an IRB approved study. In addition, we provided some clinician surveys using Qualtrics that we were launching in December of 2019 as well as June of 2020 to get feedback from our providers about the SmartSets and how they impacted them clinically. So here is just a figure that has the process and timeline. As I mentioned, we kind of developed the SmartSets. We got some key stakeholders to assist us in doing that, and they were available for clinical use in April of 2019. At that time, we did launch an email to our providers letting them know that it was available, had some quick images and screen captures to help them understand how they would access them and utilize them, and some text to assist them in navigating through the order sets. We did an in-training with some of our medical assistants on the floor so that they knew how to access these as well. And then we did have some super users at the elbow to assist people in real time when they were using the SmartSets. In terms of follow-up, we did a survey in December of 2019, which was about 9 months after the go live of the SmartSets. to assess usage, impact, and satisfaction with the integration of the SmartSets in the practice. Subsequent to that time, we did have an e-module that was created that visually represented how these SmartSets can be used, talked about how you can access them, and then also show some demos of how to use them in real time. We did a follow-up survey in June, subsequent to that e-module, and all the while in the process of doing some data mining. So some preliminary results from the data analysis from the collection from the encounters, that's still pending. Our analysts are still pulling that information, and we're organizing it in a way that would be most usable to compare over time. We'll hopefully have all of that data back by September with the plan to analyze them in the subsequent months. In regards to the clinician surveys, we did get feedback from our providers in the office. The initial survey, the pre-educational module, did have a N of 43, so we had pretty good participation then. And the majority of the participants who completed the survey said that they did see pediatric patients in our practice and that they were aware of the SmartSets. And about 75% of them felt that they were using them almost always or usually during their clinical sessions. The majority of the residents even more so than attendings and nurse practitioners. Users felt that they benefited from the activation of these SmartSets during pediatric encounters. 70% said extremely and 30% said very. And then about 87% of users felt that these SmartSets were not missing content that were relevant to the pediatric patient population. We did receive some qualitative feedback just regarding the user interface and further promotion in the department. In June of 2020, about 6 months after that e-module went live, we did have a follow-up survey. We had about 16 participants at that time. We did have a response rate that suggested that the majority of users were using the SmartSets and felt that they benefited from them. Similar qualitative feedback before, as the flow and navigation were some challenges that individuals recognized were challenges for them. However, participants felt that the e-learning did increase their knowledge and awareness, and users felt that they would like to learn more about the use of these SmartSets. Some brief conclusion. So there was a pretty high awareness of the and usage of the pediatric SmartSets, particularly in the residents. And the educational module that was launched in January of 2019 did expose some of our attendings and nurse practitioners to the tool, and it did impact their usage in pediatric encounters subsequent. The implementation of these SmartSets was beneficial per patient report. And then the e-learning did significantly increase knowledge and awareness of pediatric SmartSet availability and knowledge of use. Many clinicians felt that they would like more training on how to use these SmartSets, and they did provide some concrete recommendations for their enhancements. Some of the limitations and challenges were that when we launched this intervention, it came out of a practice need. We were actually having some low rates of vaccination series completion, particularly DTaP in the 15-month patient population. And so we thought that this would be a really wonderful way to try to capture and catch up on those individuals. However, at the time of launching this project, we had limited prospective project planning, and so we didn't really think about our methodology and analysis at the time when we were launching the SmartSet project. Additionally, we weren't able to assess pre-educational models of the impressions of the SmartSets completely. There was a technical glitch at the time when the SmartSets survey went live, where some providers received the e-learning before they completed that survey in December of 2019, and there's no way to know, unfortunately, how many of those individuals had the flip. And so there's potential that they may have complicated some of the data that we received in those responses. Unfortunately, during the COVID pandemic, which is disrupting a lot of research around the electronic health records and things of that nature, particularly may have impacted that post survey in June of 2020. We did have only 16 participants compared to the 43 of the initial, and so we felt that that may have also complicated some of our analysis of our survey responses. There was also an unknown disruption to the clinical practice, the volume of patient encounters. Some of our residents were deployed to non-FMC rotations, and so it's just hard to know how much this would have been able to been used in real time. And lastly, there is going to be a rather steep learning curve for when we use Click. Click is the tool that's helping to retrieve some of our data for us to analyze, and there's going to be some limited IT assistance when we do get the data back, and so something for us to kind of anticipate and prepare for when we do get all the data back in September of this year. So some discussion and next steps. Emails and e-learning modules may not be the most effective format for department-wide education. We did receive some feedback that providers wanted more in-person or grand rounds or lecture formats in terms of launching this information for people to use the SmartSets. Some preliminary data suggests that they are viewed very positively by our clinicians here, and just interesting to know we're actually doing some similar SmartSets that we're planning to launch for prenatal care, and so that's currently underway, and hopefully we can find other ways to implement some SmartSets to help our trainees in their education, as well as doing some hands-on didactics for them. So next steps, we hope to review all the recommendations that we received from our faculty and our residents, hoping to improve the efficiency and functionality of these SmartSets and really integrate them into our clinical practice. We hope to potentially integrate Philovax, which is the Philadelphia Vaccine Registry, to really help improve the flow and access to immunization records in real time as we're using these SmartSets. And then we'll hope to analyze more in depth all the outcomes that we're looking at and comparing pre and post intervention to see if there was any significant impact on the way we're delivering our pediatric care. And then finally, hope with this information we can do some targeted education to our clinicians, to our staff, and to our patients to really help improve pediatric well child care. So thank you for participating, and thank you for listening to my poster presentation. If you have any questions or concerns or any feedback, please feel free to email me. You can email me at my email, which is chris.foster@jefferson.edu. Thank you very much.